So I like to think about this meeting as sort of like a party, like an event. We have event hosts, we have the talent, um, and then we have the people who really bring um, they bring the spectators in. They bring everyone in, and they educate and they tell them about what's going on, and they make sure that this event is a success and that we are focused on what the people want to hear. And that is Aim at Melanoma, our 2-decade-long collaboration with Sam Guild and her family and Aim at Melanoma and its strength is abundantly clear when the meetings become less in person and more virtual. And I'm consistently floored by how many people come in through Zoom. 150 people signed up through Zoom, and there have been over 550 Facebook interactions of people checking into this meeting. And that's the power of advocacy. It's the power of intellectualizing what needs to be done and then telling the physicians where to focus, because we just need focus. I want to bring Sam Guild up to do the last and best part of this. And I think we're going to change it up a little. Sam's going to talk to us about what AIM is focused on now, tanning beds, legislation, and all of that. And then we put together some questions about survivorship and how to go through therapy. And we were going to do it one-on-one, but maybe you can ask some of the other physicians, and I'll ask Dr. Patel to come back up to answer how they would answer these questions to their patients. So Sam, come on up.
You heard earlier the number 14, and I'm going to give you another number, and that's 20. So this is our 20th year anniversary. It's an unfortunate one in some ways because it was 20 years ago that my sister at 25 was diagnosed with stage 4 melanoma. She passed away 9 months later. But the reason why 20 is a phenomenal number is because where we were then and where we are now, you would never know. And it really is because of all of us in this room, those joining us online, and everyone else out there. We are incredibly grateful for the community that has been built and the work that's been done since. So I don't know if I have a quick slide, but in the interest of time, I just want to quickly share with you some of the resources. If you registered or if you're on our Facebook page, you can easily find us. Oh, see, I don't do much technology. Nope, it's not there. So I'm just going to wing it. So Aim at Melanoma, we provide a number of resources. Next one, the toolkits. So side effect management sheets to support you on this, to deal with toxicity. We have a Melissa Wilson, who is a PA, who can help answer your medical questions. Again, I apologize, but I want to get to some of the other things. We are addressing issues about your psychological issues that you deal with beyond the clinic, living well with melanoma, the fear of reoccurrence, concerned about scans, lots of opportunities to volunteer. There's a peer-to-peer where you can support somebody going through this journey, or if you're looking for somebody to help you. We also have various up-to-date resources, and we have recently, in the last couple of years, expanded into non-melanoma. We are now providing resources for those who've been diagnosed with non-melanoma skin cancer. I apologize that the card you have in your folder is an old one because we just completely rebranded, and we are aimatSkinCancer.org, so that should be easy to remember. But again, it is about all of you and you working with us and together, making the next 20 years look nothing like what it does now. So I'm going to move over to the next thing because it is about survivorship and living with this disease during treatment and beyond. Okay, so we're going to start with the very first question, and that is, how long will it take to get better and feel more like yourself? I don't know if there ever is feeling like yourself again because you have a brand new person. Which of you would like to answer this? Oh, I see Dr. Sullivan.
I'll take the first one.
Okay, why don't you go
I
ahead?
can review the next one. So actually, it's when you get off of a therapy, so clearly fatigue and anhedonia, which is the lack of feeling like phenomenal, are some of those things. Or if I have the rash or something from it. With immunotherapy, it does take some time to get over that. But it's also the idea that during therapy, after therapy is done, when you have control of disease, etc., it is a time to bring in others to help you feel better. We have a lovely nutritionist who helps with, because the diet changes, the gut changes, etc. We have, there's a lot of negative connotation to it, but it's very positive to be able to sit with someone to help you get your mind right, to be more optimistic as things are going better. And also we have social work to help. Physical therapy is a great part of it. So it takes time. It's not that when you end therapy or you have a break in therapy, you're back to your baseline. So I'll give this back to you for question 2.
So this is a question I am actually really excited about, the fact that we get to hear it all the time. The word cure is not something that's a few years ago we even discussed. But so since many people are completing treatment, can they say, I am cured? Does that word exist in our vocabulary now? So when can I say I am no longer a patient with cancer? Who would like to answer?
So I think looking at different stages of disease, especially melanoma, and cure is sort of, it has a different meaning to different people from that point of view. For early stage disease, the efforts that have been made with either pre-surgical treatment, or Dr. Patel talked at length about neoadjuvant therapy followed by adjuvant therapy, versus individuals with advanced disease. And even in that advanced disease, there are various categories. I think that answer is a little more personalized, but I think we're learning more and more that if we can get to that complete response picture, and then that cure word, it's starting to come into play. I mean, how we get to that complete response, with either one drug versus 2 versus 3 clinical trials, however it is, I think we're starting to talk about it. I mean, in the past, that cure word used to be untouchable for most of the malignancies, especially for melanoma, since we didn't have much in terms of treatments. But now that we've gotten through BRAF inhibitors or Ipi-Nivo or Nivorella, I think all those are allowing us to have the courage to say that to our patient, that they may be in that territory of cure. And I think yesterday, I'm going to give an example of this. Yesterday, sitting in my office, and Dr. Hamid came over, and I told him, it's like, hey, you remember you seen one of my patients, 41 years old, disease in the bones and liver and lungs and brain. It's like she just had her first 3-month scan, or 6-month scan that shows there's no metabolically active disease. And his response wasn't, wow. It's like, great, that's what we expect. And I think that's the level of confidence we're gaining through these therapies, and hope that we can deliver that confidence to our patients and make them realize that we are getting to that point, and we hope to be there for a lot more, not just a handful of few.
Thank you. So our next question is, well, we heard a lot about the toxicity and the side effects that come with treatment, but what long-term health issues can I expect because of my cancer and its treatment? And I'm going to pass this off to Dr. Sullivan.
Thanks. One thing I definitely am an expert at is causing side effects, unfortunately. So I think long-term health issues are also individualized. Some patients go through a course of treatment, receive a year or 2 of immune therapy, and are wondering why they're stopping because they feel so well. on treatment and they said, it's not bothering me. I'm like, yeah, but your cancer went away. Like, there's data. We don't have to keep treating you. And if you stay on, you might not feel so well anymore. So there's certainly some patients that they probably don't have any long-term health issues. And you're probably more likely to be like that if you cruise through treatment and didn't have any side effects. There are certainly some side effects that are permanent. Most gland inflammatory side effects, thyroid, pituitary, pancreas, which leads to diabetes, tend to be lifelong, and patients need to have replacement therapy, whether that's thyroid hormone or cortisol or insulin. I think in terms of what's related to cancer, if the cancer has gone away, hopefully the symptoms related to cancer will fade over time. But if there was some catastrophic thing that happened and you know, like there was a tumor that caused a lot of problems in the brain and there was a surgery and there were some things related to that, you know, that may not go away. But I think the bottom line is, as patients get further and further away from the treatment, they're much more likely to recover, certainly from the side effects like colitis and lung inflammation and heart inflammation, all those things. And so I think there are some things that are very predictable. There are other things that are less predictable. Some patients still can develop side effects 6 months, a year after treatment stops, but that's rare. And I think you usually have a pretty good idea at the time where treatment is beginning to stop of what to expect. And so I think it's important to have a sit down with your provider 6 months, a year after you finish treatment and say, all right, here's where we are right now. These are the things that are happening. What can I do to maximize my health? Which sort of goes to like 5 and 6 on this list as well.
So I think Dr. Patel was ready to answer the next question. Anything you want to add?
Yeah, I feel like Dr. Sullivan answered 8 as well. So let me tackle 4, 5, 6, 7 because I got to catch a flight here. You know, once you finish treatment, you still have to stay in touch with your medical team. That may seem obvious, but what does that medical team look like? It's probably a combination of your primary care physician and your oncology team. You might transition to a survivorship clinic at some point after treatment. Now we're starting these survivorships 1 year after adjuvant therapy, 2 years after metastatic therapy is finished. And they can work complementary to make sure you're still doing surveillance for other age-appropriate cancers, medical conditions, secondary recurrence of your melanoma. And then I think keeping a healthy mindset as well. We focus a lot on just physical, doctor's visits and things, but making sure we keep a healthy mindset, reducing stress and keeping in a positive frame of mind. You live today and tomorrow is a gift and you don't dwell on the past, that kind of stuff.
So I'm just going to quickly follow up the last one with, and I'm going to go a little bit off script. So we notice as a patient that we're not feeling well. What do? We know we had fatigue. We know we've had many of these side effects because of treatment. What is our next step?
Call Dr. Hamid.
Well, one of the basic tenets of my clinic, and I'm sure everyone's, is that once you leave, your visit, it's not that the visit is over. Physically, it's over, but at any time where you need to be seen or you have a change, you need to communicate. So communication is important. I think in the past, that hasn't been clear, but now, with the fact that these side effects can occur at any time, even after you've stopped therapy, it's important to reconnect. It's also important for your mindset as a patient to reconnect, because I've had patients who feel like you need the toxicity for the drug to work. It's not quite clear. It's not quite the right thing to do. Number one. Then the patients at some point have the fear of calling, that this side effect may be associated with a recurrence. And the majority of the time it's not, or growth of tumor. It's not. It's what these doctors are doing to you with their therapy that's causing it. We're the problem. So it's important. It's also the ability to feel confident that you have unloaded some of this psychological pain and anxiety onto your doctor, because we can take it and we can squish it, make it smaller. We can carry some of that for you and we can resolve some of that. The secondary goal is control of disease. The secondary goal is cure and all the disease goes away. The secondary goal is to make us feel better. The primary goal in all of this is to allow you to have as normal of a life as you can have for as long as possible. And in medicine these days is not like that. You feel like people always feel like I have to go to a concierge to get better care. But I'm here to tell you, every one of these oncologists is a concierge oncologist. They're available to you all the time. They give you the best. They send you to the best. They utilize imaging and lab tests. That's a concierge doc these days, but you're getting it without the cost of a concierge. So we're always available. And the other part of it is maybe you just need to come in and be seen, because there is at a time when medicine had nothing to offer, the best thing it had to offer is comfort. The feeling that you could come and speak to someone who could decrease your fear and your pain and increase your comfort. And all of that's available at any time at your oncologist or your surgical. If I'm busy, Dr. Ferries will take you in his clinic. Okay. So we all have people who work with us and are available to you.
One other thing about that, because I think part of the question is, do you, for the rest of your life, always call your oncologist for a problem, or or some of that shared by the primary care doc? And I think one of the things that we try and do at our survivorship meetings that in our clinic that's run by one of our nurse practitioners is to be clear about what's a primary care. If you get the sniffles and you're having sinus congestion, assuming you don't have sinonasal melanoma, you should see your primary care doctor for that. If you fall and hurt something, you should see your primary care doctor and they'll connect you with an orthopedist or whatever the appropriate thing is. If you're not sure what's happening to you, you can always call us. And as Dr. Hamid said, we remain your doctor forever after you're done with your treatment. And honestly, we're now getting to 10 years after Pembro and Nivo got approved. I have no idea what I'm going to do with my patients who are after 10 years. Like, we tend to graduate people. I'm not sure I'm ready to let my patients be graduated. And I'm not sure if they're ready to be graduated, they'll graduate. But if they're not ready and I'm not ready, I'll probably keep seeing them. And it's a lot easier, I think, on some level to know that's my doctor. I see them every year and I know there's a problem. I can call them right away and they're going to get back to me. And so, I think there are clearly some things that will obviously go to the PCP. We actually relinquish control over levothyroxine as quickly as possible, even though we caused it. But I do think that there are models that are now being built to figure out how to share the care of our patients moving forward that are logical, make sense, but still allow for the comfort of having us there to take care of issues that we're not sure if it's cancer, we're not sure if it's side effects. It's probably neither of them, but come in and see me and we'll figure it out.
And I just want to say, as the patient advocate, you should be calling your doctor if you have a concern. A concern is what got you into the doctor's office to begin with, and you were right. So trust your gut. And worst case scenario, they tell you, oh no, you're healthy. You're okay. Go home. That's a good thing you want to hear. I want to apologize. I know there were lots of questions, but we are running very late and there are planes that need to be caught, myself included. It's been wonderful. We will be sending out a survey out afterwards. Please respond to it. Also, again, we apologize we didn't get to your questions. I will ask that our physician assistant, our Asking Experts email is included on that email so that you can reach out to her and get your question answered. Again, there's no stupid question. The worst that you could hear is, you're fine. So thank you so much, everyone. Thank you for flying in, Dr. Patel, Dr. Sullivan.
Thank you.